evening, everyone. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping in good health. You must have come across people, especially women, with brown color patches on their face. They seem like freckle-like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population experience skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups across 20 to 30% of 40 to 65 years old women present facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood condition, melasma sufferers have been misinformed about aspects of this condition, very common hyperpigmentation issue. This can lead to frustrating setback in treatment. So to avoid all these hassles and to keep you informed today, we are here to know more about the management of melasma and hyperpigmentation from an expert. So let's connect today with our skin expert, Dr. Pallavi Kashyap, live from Patna to understand how to get rid of melasma and hyperpigmentation. Dr. Pallavi Kashyap is a highly skilled and experienced dermatologist based in Patna, India. She specializes in a wide range of skin, hair, and nail conditions and is dedicated to providing her patients with the highest level of care and attention. Dr. Kashyap will work with you to develop a treatment plan that is designed to achieve the best possible results. In addition to her expertise in medical dermatology, Dr. Kashyap also offers a wide range of cosmetic services, including laser hair removal, chemical peels, injectable treatments. She uses state-of-the-art technology and cutting-edge technology to deal with all of this. It's a pleasure to have you with us, Dr. Pallavi. Welcome.
Thank you, Sayukta. Thank you for such an elaborate introduction. Thank you so much.
Dr. Pallavi, we'd also like you to mention about your clinic because it has all the advanced treatments and techniques, right? So please, what's your clinic called and what all modern day updates and technology you uses?
We have established a clinic called Dr. Kashyap's Skin, Hair and Laser Clinic just 2 months back in Patna, Boring Road. So you can get all the details online as well. We are providing all the services available like PRPs and MNRF and hair removal, chemical peels, fillers, Botox, you name it and we have it. So just whatever your dermatological queries are, you can visit us and we are there to sort that out.
Wow, that's wonderful. And today, Dr. Pallavi, as we are talking about melasma, hyperpigmentation, it's so common, especially as women, as I just said in the introduction. We would first like to understand, Dr. Pallavi, what is melasma?
And the moment we started this live session, you've already introduced what is melasma. And as you said, that melasma is nothing but hyperpigmented macules and hyperpigmented patches present over your face. It is sometimes present extra facial also. So it can be present over your hands, it can be present over your neck, it can be present over your back, but it is rarely happening. It generally primarily just affects our face and it is bilaterally distributed and looks like black patches over your nose, over your cheeks, over your eyebrows, over your forehead. Generally, the areas which are more prone to sunlight, which are more exposed to sunlight, that's what melasma is.
Right. And as you said, generally the area which are more prone to sunlight. So is sunlight the only cause responsible for melasma or are there other causes as well?
Not the only cause, sunlight is the primary cause. The UVA and UVB rays and the infrared rays are mostly responsible for melasma. Our skin is our Fitzpatrick's type 4 skin we have generally, and that is more prone to post-inflammatory hyperpigmentation and hyperpigmentation disorders. Melasma is one of them. So definitely when our skin is more prone for tanning, we have to prevent ourselves from sun as much as possible. The sun is one of the major causes.
Mhm. Right. Doctor, whenever we, talk about melasma, melasma sounds very technical, the term. We are more used to pigmentation or hyperpigmentation. So are they different, melasma, hyperpigmentation, or they are the same? Please shed some light over there.
Melasma is basically a specific name given to a disease. Hyperpigmentation is a vague term, which means more amount of melanin in the body, or more amount of melanin present in somewhere specific area. So that is called hyperpigmentation. Hypo means less, hyper means high, right? More.
Mhm.
So that is a vague term. Melasma is a different characteristic and a different disease altogether. So yeah, you can say melasma is a type of hyperpigmentation. Correct. Yeah, you can say that.
Right. So hyperpigmentation is a broader term. Melasma comes under its, right? So all
Yes.
kinds of melasma could be hyperpigmentation, but all hyperpigmentations can't be melasma.
True.
Now, the thing is, what are the signs or symptoms of melasma, doctor?
So, as we discussed, you'll see black or hyperpigmented patches over your mostly sun exposed areas, mostly over the face. And it is not derived these days because of the age, also. But yeah, generally, the elderly people, like more than 40 years of age, experience melasma more. And generally, melasma is more seen post pregnancy, also. That is called cloasma or mask of pregnancy. And so, yeah, it is more seen in females as compared to males.
Right. So women's suffer more from melasma. Now, doctor, what are the risk factors? As you said, sunlight is one of the primary reasons responsible for melasma. So, does exposure to sunlight, I mean, that increases the risk factor, or what other risk factors are there for melasma?
See, in our society, we still think that wearing a sunscreen is a luxury, right? But these days, we have to think about wearing a sunscreen is a necessity. So, if you are not wearing a sunscreen, you are prone to a sunburn, you're prone to PIH, you're prone to melasma, you're prone to photoaging. There's so many things, not only melasma. So, sun is the major factor for so many skin diseases, generally, which are more generally to the area which are more exposed to sun. So, yeah, sun is the major factor. Again, as I told you, that during pregnancy, also a lot of females have suffer from melasma, which is termed as cloasma. And generally, female who are more on hormonal pills like oral contraceptives. So those people are more prone for melasma because of the hormonal imbalance. Generally, vitamin D3 also plays a role. So yeah, these are the things which are basically leading to melasma. But again, stress is also one of the factors, and often people compare that genetics are involved in melasma. Yes, it is true. 60% of the people who have melasma in their family are more exposed to this melasma. But it's certainly not true that if it's there in your family, you will have it.
Fair enough. And doctor, we always say, especially in medical, that prevention is always better than cure. Any way to prevent melasma?
As I said, just protect yourself from sun. And if you're taking oral contraceptives or any oral hormonal supplements, just consult your doctor that what should be the duration and how long should you take it and how can you curtail that. And definitely post pregnancy, if you're facing any hyperpigmentation, you need to go to a dermatologist and ask for the remedy. And certainly you have to, when you're suffering from it, you need to consult a doctor or dermatologist. Don't just go for any self treatment or any certain medications. There are so many triple combinations available. Just don't go for that and spoil your skin further. Melasma is a very difficult to treat condition anyway, so you need to meet a qualified consultant to basically start with your treatment.
Right. As you very correctly mentioned, doctors, that it's important that we go and consult the right person, which is a qualified dermatologist in case of any skin, disorder, including melasma. Because if we keep on delaying or try other things, which we normally do, there is a trend in our society that will go for home remedies or will go for dadi ka nani ka nuskha or will go for friends or relatives suggestion who had gone through the same, problem. And many times we'll borrow their prescription, go to the chemist, get the creams and start our own treatment. We become our own doctors. How, risky or how difficult it can make our condition.
See, people, there are so many things available in the market. The hydroquinone is there, retinoid is there, tranexamic acid is there, triple combination creams are also available, especially corticosteroids. People are just rampantly using corticosteroids over their face and coming with a new term called topical steroid damaged face or steroid induced rosacea. So
Okay.
just whosoever is selling the drug at the chemist counter, they should be a little cautious enough that they are just not giving anything to the patient, because patient is sometimes innocent, sometimes over smart. So you have to basically see that please don't be innocent also, just use anything over your face, and please don't read everything on Google and go and treat yourself. Don't do that. Always visit a consultant who is better read, well read, and who is better at their job to actually help you.
Right. And these days, influencers are there, so many influencers, so many reels, etc. Is it a fad or a fad? How would you like to address this?
See, sometimes these influencers actually create a lot of awareness also. So that
Hmm.
point is good.
Right.
People are not aware of these issues. So actually, when they do that, people get aware and they know ki kya karna hai, kya nahi karna hai. But don't get influenced by them, as the name says. Always keep your mind smarter enough that you know whom to visit, what to do, and how to proceed with it.
Right. So use your own brains as well, and don't go to an extent where you, end up worsening or damaging your skin more. I'm
Exactly.
sure Dr. Pallavi, you also get patients who have already, worsened their skins. Many times we develop a lot of rashes because we try over-the-counter medication, or thick hairs as well, facial hairs as well, which were not there before. What all complications can OTT or, over-the-counter medication or home remedies they can lead to?
As you correctly said, that a lot of hirsutism, as we call, a lot of hair, thick hair on the face, then a
Right.
lot of hyperpigmentation, then thinning of the skin happens. Thinning of the skin leads to further rosacea. You can actually see red, maroon faces roaming outside. Then again, as I said, topical steroid damage face happens. Then again, hyperpigmentation can worsen also if you are completely and overtly using those products unnecessarily without a doctor's consultation. And primarily, if you're not using any depigmenting agent without sunscreen, then you are doing a blunder. You should always use a sunscreen, and then you can only go for a depigmenting agent also. So there has to be a combination of both. And please ask your doctor which depigmenting agent you should use and what is the cause behind your melasma. See, melasma has sometimes the etiology is unknown. Half of the reasons are not known that why it is happening to the patient. But if you'll discuss the complete history with your doctor will certainly help you that these are the steps you can follow to actually prevent it. Whenever a patient comes to me, I often tell them that melasma is a lifetime condition. Sometimes you have to live with it throughout your life, but you can always maintain it, you can always reduce it, you can always prevent it further. So please do that. Meet your dermatologist, they'll give you a certain idea about it, they'll suggest you certain treatments. There are so many treatments available, so go ahead and do that.
Right. And as initially we were talking that many times people, and that's again a very big trend in our society, we go for home remedies. It can be good for, various other reasons or other fields, but what about pigmentation? Papita laga lo, curd laga lo. I have seen many people using lemon juice, lime juice over their face because they feel that it will, what's again your take on that?
I think all these home remedies should limit themselves to the platter, the plate should go inside, not over your face. That would be better. I've seen so many people using potato over their face, rubbing and stubbing their face with a potato. So please have it in your meal. Don't apply it over your face. That would be my suggestion.
And as you just mentioned about meal or, having food or fruits, Again, of course, this one saying is there, which people, often use, that whatever you eat, use it on your skin and scalp as well, which you just said that it's, not going to help you, just eat it. But how important can a healthy meal or a balanced meal go in restricting melasma, or treating or preventing melasma?
See, that is a saying that whatever you eat is basically reflected over on your skin, also on your body also. So you should definitely have a healthy meal, a rich in fiber meal, rich in vitamin C, a lot of minerals should be there. You should avoid a lot of junk. You should avoid a lot of sugary substance, because a lot of sugar and a lot of dairy creates a lot of inflammation in the body, which leads to further other issues also, like acne and seborrhea. So many other issue happens because of dairy products and all. So I'm not saying that you should completely avoid it. You can always have a balance between the two, and have lots and lots of water. People don't drink water, I don't know why. So just have lots and lots of water as much as possible.
Right. So we have, in a way, covered that what we should not do. Right. Now let's talk about what we should do. You said that sun is one of the primary, or main reasons of melasma. Now the question is, to safeguard our skin from sun. um, like many people, as you said, that sunscreen is still taken as a luxury in our society, but then many of people feels that sunscreen is required only for those who are under the sun, who works under the sun for long, long, long hours. So, how helpful is sunscreen in our day-to-day life, or also those who work from home, or who are, mostly inside their house? How important sunscreen is?
Sunscreen should be like wearing your clothes. Like you wear clothes to protect your body, you should always have sunscreen over the visually more affected areas, which are more prone to the sunlight. Okay. And with sunscreen, we don't mean that you should only protect it from the sunlight. The infrared rays and the blue light, which is emitted from the screens, from your phone screen, from your laptop screen, the sunscreen also prevents you from the blue light emission. So please have sunscreen when you're indoors as well.
Right. So sunscreen is very important no matter whether you're in or out. So, like we are working in front of our laptops, or, mobiles or tablets, or the LED lights in our house or offices, etc. They're equally damaging for our skin.
Of course it is. I mean, during COVID days, people were spending half of their time, more than half of their time in front of the screens. So definitely the blue light is hazardous. It's hazardous for your eyes also, and it's for your skin also. It causes AIH, causes damage. So you should always have a sunscreen put on even when you're indoors. These days, oral sunscreens are also available. So you can have oral sunscreen when you're going for a mountaineering, or you're going for a beach vacation or a swimming pool. You can always have oral sunscreens as well to prevent yourself from tanning.
Right. And then there are so many excuses that people, give for not using sunscreen. Like, I have a very oily skin, so, sunscreen makes my skin patchy, or it made me sweat a lot, or it will lead to more acne, or my skin feels very dull after I use sunscreen. I'm sure you also get patients who, use these kinds of excuses, or who have various reasons for not using sunscreen. What you normally tell them?
That's why it becomes important for you to visit your consultant and ask which sunscreen is better for your skin type and according to your profession. Because there are various sunscreen available, chemical, physical, mixed sunscreens, oral sunscreens. But what the purpose it is going to be solving for you, that is important. So you should always visit a dermatologist and ask what all moisturizer and what all sunscreens is better for you.
Right. And of course, there are various sunscreen as per our skin type. So we should choose the right one. And for that, definitely a qualified dermatologist will help. So please go and consult a qualified dermatologist in case you have any troubles related with your skin. And in fact, even for, choosing your basics, like your moisturizer, your cleanser, your sunscreen, sunscreen, please go and consult them. You'll definitely get better advice. Now, doctor, whenever we go and buy a sunscreen on our own, there are so many informations written on the box, like the SPF, like it is water resistant or not, or whether it's gel based or it's, good for which skin type. Now, one of the major factors while we choose a sunscreen is the SPF, but then we don't know even a 70 SPF would be better for our skin or a 20-25 SPF. So please shed some light over the SPF factors and other things that we should in general keep in mind.
See, sunscreen are basically available as physical sunscreen, chemical sunscreen, and mixed sunscreen. Three types of sunscreens are available. If you are exposed to a lot of sunlight, you should always go for a physical, thicker sunscreen. And if you are working indoors and you have a job where you don't have to be exposed to sun so much, you can always go for a mixed sunscreen or a chemical sunscreen. There's no harm in that. And then again, as I told you, that if you're going for a vacation or anything, you can always go for an oral sunscreen to prevent the overall tanning. And when it comes to SPF, which is called the sun protection factor, so for Indian skin, for our skin, it is better that you use a 30 SPF, minimum 30 SPF, and you can always increase it. Sun protection factor is nothing; it prevents your skin as far as you keep on layering it. If you layer a 30 SPF sunscreen, again layer it over again, then it becomes 60 SPF. It keeps on increasing as per the sunscreen you layer. So it is nothing but just 30 SPF you should stick to minimum. And always go for a dermatologist and a dermatologically tested sunscreen. Just don't fall for the trap of using any nonsense sunscreen, which is not going to help you. It's going to harm you further.
Right. So don't become don't get into the trap of the marketing gimmick, and again go to a dermatologist to understand which sunscreen will suit you the best. Now, Sonia Singh is with us, a viewer of ours, and she's asking, I'm pregnant and is having melasma. Again, melasma is very common during pregnancy. What to do, doctor?
Yeah, again, see, pregnancy, you almost 80% or maybe 60-70% of females have melasma, and it gradually fades also after pregnancy in so many females. So you don't have to panic. Just use your sunscreen and whatever serum you are using, and don't go for any rigorous depigmenting agent. Just enjoy your pregnancy. Stay protected from the sun as much as possible. Don't indulge into any oral supplementation, and please consult your dermatologist if you are very much concerned about it.
Okay. And Monica is here, again, a viewer asking, will it go away on its own, the melasma, in normal conditions, not in pregnancy?
Sometimes melasma fades on its own with time. That also happens. But my suggestion would be, why to live with it when you can actually treat it?
Right, exactly. Sonam is here asking, what vitamin is good for melasma?
Generally, antioxidants and tranexamic acid really work wonders for it. You can go for glutathione supplements, you can go for vitamin C, vitamin E, and of course, tranexamic acid oral also helps. But again, I'm always encouraging, whether you know it or not, but please consult your dermatologist before starting anything.
Right. Ajit Singh is here, and he's asking that what are the causes of various types of melasma or hyperpigmentation?
I think we have discussed that in the whole discussion. Yeah.
Yes. Now, doctor, I would like to understand what is the line of treatment that you as a doctor follows, and before that, when a patient comes to you, I'm sure they comes in various phases or levels of melasma, some at a very initial or primary stage, some in their advanced stage. What you do first, and then what's the line of treatment?
See, it depends upon what the age of patient is, what requirement of patient is, and what we have to see the budget of the patient also. Sometimes you cannot just give anything to the patient. You have to see how affordable is the patient, and so many other things are also taken into consideration. But I often start with a sunscreen, a cleanser, and a depigmenting agent as per the condition. And I often tell them that basically in melasma, it is required, you should counsel the patient well that this condition will be there with you, and you have to be with this condition maybe for the lifetime, or maybe it will go gradually, but it is a time taking condition to treat. So the counseling becomes the very important part. Later on, we can go for lasers, we can go for chemical peeling, we can go for oral and topical supplements, we can go for lasers also, we can go for PRP therapies, we can go for microdermabrasion. It can completely, we have an array of things available for melasma. It is just dependent upon what patient's requirement is and how the patient wants it to be proceeded further. Because these days you cannot just say anything to the patient and patient will listen to you. You have to have a healthy discussion with them. What are they comfortable with?
Right. And as you were stating initially that you deal with a lot of modern techniques, laser treatments, etc. How helpful are they in treating melasma, and how soon we can actually get rid of? But you have already said that it can take time and it depends on various factors. But still, has it made the whole treatment easier?
Of course, the lasers are there. Q-switch laser you can be used, and then sometimes I combine Q-switch laser with PRPs. Sometimes I combine PRPs with microdermabrasion. That is certainly depending upon again the patient's condition and what patient requires. And it definitely helps if you do the treatment and you're consistent with your treatment for 6 to 7 months. You'll certainly feel the difference. Yeah.
Okay. Kirti is here asking what are the benefits of gummies, nutrient supplement gummies for skin. And I think it's a very good question because these days, again, as we were, talking initially that how much interest people are showing in the social media and advertisements, floating over the social media. And gummies is the most in thing these days. So people are just going for these gummies. How helpful are they?
See, as per my knowledge says, popping a pill will never sort any issues of yours until and unless you know what is causing the issue. So the causative agent has to be triggered first rather than just popping anything. It will just certainly not help you. I know people like all the actresses are popping gummies on television these days, but that is not the right way to progress towards your skin health. You should first certainly know what is your skin type, what all diseases you have, what all prevention you should take, and what all products you should use. Just don't fall for all that. Yeah.
Right. Rohit is another viewer asking, can melasma turn into cancer? Can melasma be cancerous?
No, melasma is a certainly different condition. Yeah, it is a hyperpigmentation, but no, it is not cancerous at all. But yeah, if you certainly expose your skin a lot to the sun, it can change into a cancerous condition, but that is different from melasma.
Okay. And doctor, as we were talking about the importance of sunscreen, now we also know that it's important to, apply sunscreen, or reapplication of sunscreen is equally important, or whenever we go out, we should apply sunscreen before some time. So we would like you, because you're an expert, so we would like to understand how to use sunscreen, how important it is to also take care of the application part.
See, I often tell my patients to apply sunscreen every 3 hourly, like 8 a.m., 12 p.m., 2 p.m., like that. Or they can always apply too early also, because sunscreen has to be reapplied. And before going out, or even in the morning also, just apply half an hour before the exposure. That would be better.
Right. And as we were saying that, it is more common, melasma is more common in women, but I'm sure men also, get it. Now, is the treatment or the prevention part changes for them, or it's the same?
The treatment remains the same, but the causative agent in men is mostly due to stress and due to this alcohol, smoking, and generally, I don't say that female are not doing it, only men are doing it, everybody is doing it. But yeah, this is one of the major reasons for men, because in females, generally hormonal imbalance and pregnancy causes melasma. In males, the factors are different, but the treatment remains the same.
Right. And when we talk of, sunscreens, women have these sunscreens with them. Even if they are not using it religiously, they'll have it. But men have not yet started using it. The saddest part is that even despite the conditions, the weather, the temperature in India, many men, many women are still not using sunscreen as the integral part of their skin routine. What would you like to add to that?
That's there. That's there. Men are quite not into the skincare routine, but happily and nicely, these things are changing. I have so many male patients also, and I've been happily prescribing them sunscreen, and they are quite conscious enough that they're using it also. They're going for hydrofacials, PRPs, chemical peels. Yes, men are also getting involved into all this, and it is a good thing to take care of your skin, to look presentable, to look the way you want. I mean, this generation is all about visual medium. So why can't you look the best and enjoy?
Right. And are there any other health hazard of melasma, or it's just the appearance? Because, with hair fall, we say that there can be an underlying, medical condition. Is it the same with melasma, or it's just the appearance?
See, with melasma, we go for a thyroid checkup, we go for hemoglobin levels also, and I said D3 levels should also be taken care of. So, yeah, a few things you have to take care of if the melasma is persistent. Sometimes liver disorders also lead to hyperpigmentation, and sometimes insulin resistance also lead to hyperpigmentation, which is often confused with melasma. So, obviously, your internal conditions have to play a role in melasma also.
Right. And as you were saying that it's important for any, be it skin condition or any other medical condition, to be healthy, you need to have a healthy meal, balanced meal. How important is a healthy lifestyle? Because you also said that stress could be one of the factors for melasma. So how far healthy lifestyle, and what all, comes under a healthy lifestyle, which can go in preventing or dealing with melasma?
Again, we discussed that we need to have a healthy diet, a lot of fluids in the diet, and you can always involve certain vitamins into your diet, and then D3 levels you have to check. And melasma leads to stress, and stress leads to melasma. So they are basically directly proportional to each other. So you need to have a meditation, you need to have something in the day, not only meditation. At least 1 hour of your life, the whole day, should go into something which you actually like, which de-stresses you. I'm not saying everybody should do yoga, and I'm not even against it, but whatever you like and whatever makes you feel happy and de-stresses you, one should do that.
Right. There's one more thing, doctor, and it's again very common. We have discussed in certain pieces, but because many of us do it. Like, for example, I have a friend who has, gone through the same hyperpigmentation or melasma disorder, or a relative. So I'll simply borrow their, prescription, and then go and worsen my condition, and then, come to the doctor. How difficult it becomes for you as a doctor to treat a condition which is very primary or initial in that stage, or someone who has actually worsened their condition and then came to you? What is the difference?
Of course, if somebody comes to you in a primary stage, you can actually get started with the treatment. And if somebody has worsened it and come, you have to first treat the worsened part. Then you have to concentrate on what the etiology is and what the other factors are involved. And finally, you'll concentrate on the disease. So the time duration increases, and you have to constantly counsel the patient. Such patients start developing doubts over their consultants, because they are actually not happy with the treatment initially, because they want quick relief. That's why they have gone for the self treatment also. So they keep on visiting different doctors, which is called doctor shopping. And it worsens the condition more. So I would suggest people that if your condition is melasma, you definitely should stick to one consultant, discuss your history, discuss what your treatment is, and trust the process, trust the doctor, and go on with it, because you cannot have a circle of 20 doctors and everybody would do the more or less the same thing to you. So
Right.
please trust one person, go to the doctor and consult the doctor, take the treatment and continue with the treatment and stay happy. Don't stress yourself too much that I should go here, I should do this from there. That certainly doesn't help. It worsens the condition further.
Right. Vipin Patel is here asking, there are a lot of skin lightening creams in the market. Are they beneficial in treating melasma?
One should never go for anything which says skin brightening and lightening. Okay. That certainly never happens. And if you are going for it, you should always consult a dermatologist before starting on any brightening treatment. Let your doctor decide what brightening treatment you require.
Right. Anything, doctor, that we have, missed on, or anything that you would like to add in the whole conversation related to melasma and hyperpigmentation?
No,
Or
I
anything?
think we have beautifully discussed all the aspects of self treatment and with a very concise time also. So I think people will be benefited out of this conversation and will not hate me too much.
No, no, definitely they are not going to hate you. Rather, they'll, I'm sure if they are in and around Patna, they'll, go and consult you rather than wasting their time, money, and energy in trying home remedies or over the counter medication. Before we sum up, doctor, any take home message for our viewers, or, in nutshell, the whole conclusion or gist of the whole conversation?
Three things I would like to say: wear your sunscreen, protect yourself from sun, and don't stress yourself too much, and don't go for any self treatment. That's all.
Thank you so very much, Doctor. It was wonderful talking to you, and it's a pleasure. It was a pleasure to have you with us, and we really look forward for many more informative sessions with you for our viewers. It was great to hear you, and thank you, viewers, for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you, and keep glowing.
Thank you so much. The pleasure was all mine. Thank you.
Thank you, Doctor.